If our people in whichever organization can surrender their best selves with their ideas and mistakes and be open and transparent, that's when you have productivity. That's when you have innovation.
The Giving Habit, brought to you in partnership with the Majority Trust. Learn more about how they do philanthropy differently at majority.sg. Welcome to The Giving Habit, the podcast that uncovers the grit, hope and creativity of social impact. I'm delighted to be joined here in the Sydney studio today by Jetha Devapura. Jetha is a good friend of mine. He is the founder of CCC. It's a charity that does some really good work in Sri Lanka, which is a country close to both of our hearts. He's also the founder of the Let's Talk program, which is a program that's designed for families, for universities, schools, organisations, really about building psychological safety so that people can be seen and heard and valued. We're going to be unpacking all that and more. Jetha, welcome to The Giving Habit.
Thank you. It's lovely to be here, Stephen.
Yes.
Thank you for the invite.
Yeah, not at all. It's great to see you again.
Yeah.
I want to make sure that over the course of this conversation, we cover off not just the incredible work that you're doing with CCC and now with Let's Talk, but also your backstory, right? Because part of the whole idea behind the Giving Habit is to show people that anyone, anywhere, can spark change, can make impact happen. And I think your story is a really important example of that. Mm-hmm. And so maybe let's start there. 22 years ago, you visit Sri Lanka, right? So there's a heritage there, and you're visiting that beautiful country, and something happens. An opportunity presents itself, and you lean into that. Yeah. Maybe let's start there and tell us that story.
Well, it was actually late 90s when a mutual friend invited me to the cancer hospital in Colombo, mm-hmm. and I was walking through the wards, and they were actually part of the Lions Club of Havelock Town in Colombo. And I started seeing mainly mums and their children on the floor in corridors in the cancer hospital, in the cancer wards. And then I said, what are these people doing on the floor? And they said, oh, they're floor patients. I said, what do you mean floor patients? Well, they come from faraway places and they become outpatients after their initial treatment of chemo or radiation. And they have no place to stay. There's no transit home as such. So they sleep on the floor. And I just couldn't walk away from that, Stephen. You know, I just couldn't walk away from that. So came back to Australia, back to Melbourne where I live, and got a few, family and friends together, started a small fundraiser, and that's how it all started, you know. Yeah.
You saw something and you couldn't look away from it. You felt compelled that you had to do something.
Yeah, look, and I think many people have come through that journey to see the outpatients, and there's been so much generosity. But for me, I knew that in Australia, outpatients who come from faraway places stay in a transit home, like they call it the Ronald McDonald House. And I thought, wouldn't it be great to copy and paste some of that best practice to Sri Lanka? And hence started the organization. And I remember initially I thought, let's just focus on raising some funds to buy some medication, because some of these kids who were going through chemo, they were running out of medication, and the kids used to vomit, And as you know, kids who are going through chemo and are also sick and vomiting can't hold their food down, and as a result, they're not getting stronger. So initially it was actually to raise funds for some medication, and then all of a sudden 400 people turned up for that first fundraiser in 2003, 22 years ago. Wow. And I thought, oh my gosh, and we raised $10,000, which a modest $10,000.
No, but that's fine. You had 400 people.
Yeah.
That's the first lesson here, isn't it? It's like, wow, you say you're going to do something and you put it out there, and it's incredible that people lean in, right? People want that. But you've got to be the person that sparks the change, right?
Absolutely. And then started the journey of, well, hold on, we can do more than medication here. And then we actually refurbished a small ward. And then we said, look, the best practice is to build a transit home. Over the years, from then onwards, we ended up raising $1.6 million in Australia and Sri Lanka.
Wow.
And today we run a 200-bed transit home in that cancer hospital and inside the hospital. So the outpatients, after their initial chemo and radiation or surgery, they walk to, we call the CCC House, which is under our CCC Foundation organization. And it's a home away from home. In fact, I was in Sri Lanka. We do a bike ride for our Lifeline Centre, which is another project.
Yeah, we'll come on to that.
And I visited the cancer hospital and I visited CCC House. And, the stories you hear of gratitude, of thankfulness, the stories I hear, apart from the suffering that, there was a mum and a child there, a 14-year-old girl with the mum. And, midway through talking to them, the mum said, "Is it okay if I talk to you without my daughter here?" And then she shared with us for the first time that while the daughter was going through her treatment and staying with us, her father passed away. And in the last 6 months or 8 months, she doesn't know that the father is not alive anymore. He had a brain hemorrhage and he passed away. So apart from the battles of cancer, the suffering, the everyday suffering of people is something that we need to acknowledge and do something if we can do something, even in a small way.
And you're absolutely doing something there. I mean, the CCC House must create such a, it's a place of refuge and safety, isn't it, for people going through some really tough times. Yeah. Maybe talk to me a little bit about the name, because I think folks would be interested in that. And I'm interested in it because I have this kind of belief. I've heard it a few times recently. I believe it. Right? You write your strategy in pencil and you write your values in ink. You've gone one step further. Right? It feels like your values are written in the name of the foundation itself, right? CCC. So talk to me about that.
I think the values started before the organization, and the values actually started many moons before even starting this charity in 2003. It probably started 10 years before.
Okay. Through
my journey with mental illness.
Okay.
So, you're a corporate person, and
I was,
and I was a corporate person for the last many years, last 30 years, and in that climb of that corporate ladder, when I was in my early 30s, I had an experience overseas as an expat, and I predominantly lots of pressure, lots of isolation. And I soon found out that I'm pretty hopeless when it comes to living by myself, away from family and loved ones. So I came back after 2 years of stint of looking after. I was based in Southeast Asia, looking after the customers there. I came back to Melbourne, and you could say I was probably half the man. I went to the doctor, I went to a psychiatrist, and I was diagnosed with a mental illness called OCD, obsessive compulsive disorder. It's a anxiety disorder which I don't wish on anyone. And it's not the anxiety, it's not the OCD that people say, you're putting, your pencils straight or your book straight, that's a little bit of, control and convenience. But for me, OCD was a painful experience. And once you have a mental illness, it doesn't mean that it goes away. You just manage it. And at the moment, thankfully, I'm managing it really well. And I'm on top of things. And I actually think back now and say, thank you so much for my OCD, because it's changed my life, honestly. So during that journey of OCD where, for me, the anxiety was all about cleanliness, or have I done something correctly? I'm a bit of a perfectionist, a detailed person. I'm an engineer background. And, checking things, not just once or twice, but 15 times. And I remember the anxiety is so great that it would drag you like you were a drug addict, to check it one more time. That's the compulsiveness. And the only way is to sit with that uncomfortable feeling, sit with that discomfort. And I remember going into a news agency once, and I saw this word courage. And I thought, that's what I need. I need courage to sit with this discomfort and not give in. And the word compassion came to me and the word commitment came to me. And all of a sudden, these became, I guess, my virtues, my guiding principles, my healing virtues, I could call it, of courage, compassion, commitment. Courage to get out of bed. Courage to not go and check it for the 15th time. Compassion to be kind to myself. Compassion, especially when you're going through anxiety and even depression. You're very harsh on yourself. It's having the self-kindness and commitment to keep going, to get out of bed and keep going. And it just became this beautiful healing circle for me. That's 10 years before I even started the foundation. And when I met those kids that I couldn't walk away from, I thought to myself, what should I call the foundation? And it was kids with cancer. And initially it was Care for Cancer Children because it rhymed with CCC Foundation, courage, compassion, commitment. Then I actually said, I flipped it the year after and called it CCC Foundation. Courage, not just through my journey, but I look at the mums and the dads and those kids on the floor, the amount of courage they need to have to go through that pain and suffering, go through something hideous as cancer. The compassion they need to have for their children, the compassion for the people who help us, donate. You've helped us in so many ways in the past, and now, and it takes so much compassion. And compassion is not just about feeling sorry for the other person. It's not sympathy. It's about being able to sit in pain and be there for that person. Yeah. And so many people,
regardless of their circumstances as well, regardless of whatever's going on, you might have all sorts of views, but fundamentally they're a human being. Yeah. And they deserve compassion in that moment. And
obviously the commitment, because end of the day, without the discipline of commitment, nothing really happens.
Wow.
So they've become the circle.
So the values that you held for yourself, I must admit, I didn't know that, and now I see that. So it's something that you are holding for you, and suddenly this opportunity almost comes up. It's like, hang on a second, I can now take these things that matter to me and apply them in a different context. Absolutely. That's a very powerful connecting force.
Yeah.
Wow. Huh. A sort of a purpose, I think you were referring to earlier. Right?
Yeah. So. And I jokingly say I turfed my Prozac to purpose. And what I meant by that is, I know a lot of people, I've heard, how did you find your purpose? How did you find it? You don't go looking for purpose. And I think one of the ingredients for me, where purpose started, was for my pain. For my pain of anxiety, the pain of a mental illness, having a mental illness, diagnosed with a mental illness. And I think the first step was that little step I took for me to help those little kids. It wasn't a transit home at the start. It was just buying some medication, buying some toys. Okay, that little step. And all of a sudden, from this end, came this thing called, that emerges, when I reflect back, I can see that, called purpose. As I got deeper, the purpose came closer to my pain, and that beautiful intersection of purpose and pain, I call power. The power to serve. When you serve others, you serve yourself.
Yes.
Really, end of the day. And that was for me the healing. That was me, drug-free. OCD is just something I manage now. It doesn't come to my life at the moment. And that's why I say I turf my Prozac to purpose, because I really... You really find your power.
Yeah. Okay, so there's a couple of things. Just make sure we kind of land that properly, because it wasn't purpose. It wasn't like you going out there going, I'm full of purpose, I'm very clear about what I wanted. It was an accidental piece. Okay, there's a certain intentionality. You were aware, you were alive to the moment. You were certainly, you were lifting your gaze beyond your own circumstances and seeing someone else's suffering, and you felt compelled to act. So let's be clear. But the purpose emerged from that. And I think that's one of the myths, isn't it? That, I can't do that. I don't have that clear sense of purpose. You don't need to necessarily. Purpose will find you if you're intentional, right?
Absolutely. And it starts with the act of service.
Yes. That's the second thing you said that I thought was super important in that, was that idea of when you serve others, you serve yourself.
Absolutely. I mean, and you don't go out there trying to serve yourself.
No.
You there go with the pure mind of duty. You know, the duty of service. And I think that is something inherent in us human beings, is the fact that we're here to serve.
Yes.
You know,
yes.
Not just to get back. It's initially to serve, and the service will come to you in the process.
I 100% agree with that point of view. It's a core value, being of service to others, and there's so much learning and goodness that can come from it. And so it strikes me that service to others became a very powerful tool within you, right? Or a source of power, and it started manifesting itself in lots of different ways. So CCC House, brilliant, and then it starts to expand. Your journey extends beyond. You talked about the kind of mental anguish that you'd witnessed in CCC House and some of that suffering that existed. Was that the spark to then look more broadly at some of the other components of CCC?
Yeah, I think CCC House was for the fact that I just couldn't walk away from those kids on the floor and the mothers and the fathers. But my story was mental health. My story was mental illness. And I found out that Sri Lanka had one of the highest suicide rates in the world. In fact, in the top 10. I mean, we're talking, in the last, 20 years ago, 15, 20 years ago. And even before that. And I thought, wouldn't it be great? We've cut and pasted a transit home. Wouldn't it be great to cut and paste a crisis support line? And in Australia, the biggest crisis support line is Lifeline. And so, believe it or not, Stephen, I picked up the phone and called Lifeline and said, can you please help me start a Lifeline centre in Sri Lanka?
We actually called the main helpline.
I just called them. Not the helpline. I just called a number. I can't remember exactly who. But it was a lady who said, in fact, here's the president of Lifeline International, Mary Parsons at the time. And, she was in Melbourne for a funeral, actually. And I said, do you mind us catching up? And I always joke about it. It was that bottle of red wine Mary and I consumed. And 6 months later, we had 2 trainers from Lifeline, Hobart of all places, go to Sri Lanka to start the first help us to start the first Lifeline Centre.
Wow.
And today, 15 years from now, we call it CCC Line, like CCC House, CCC Line, phone number being 1333.
Yes.
Today, it's the #1 crisis support line in the whole country. And we get...
let's just say, how many calls? Let's talk about the volume.
Okay, so...
a sense of that.
We started with 10 calls a day because nobody knows us.
Yeah, of
nobody
course.
knew us, 1333. And then, we grew to, 10,000 calls a year. A couple of years ago, it was 30,000 calls. Last year, we topped it at 60,000 calls of crisis support calls. And we just have one centre at the moment. And we've we had one centre a couple of months ago, but we just expanded to 2 others.
Oh, really?
Yeah.
Oh, congratulations!
Yeah.
I didn't know that either.
Yeah,
I've been to the office in Colombo, the original one,
and it's a beautiful model because rather than going and opening up another centre and having all that asset, the cost, we actually partnered with 2 organisations. One, a corporate organisation who said, "Hey, guess what? We've got a room there.
Yeah.
Let's put some phone lines. Let's get your crisis supporters in there. In fact, maybe you can tap into some of our employees." And a university, KRU, said, "Oh, we've got a room and we've got psychology students who can do their internship with you."
Wow.
How brilliant is that?
KRU. That is fantastic. Who was the corporate? Let's give them a shout out as well. Who was the corporate?
ACL Cables in Sri Lanka. ACL Cables.
Good on them.
Suren Madanayaka, who's also on our board of CCC Foundation in Sri Lanka.
Wow, that's fantastic.
And KRU, the university. Brilliant.
Yep.
And they're doing amazing service. And I've got an amazing team in Sri Lanka. I've got an amazing team in Australia. A big shout out to them. And this is not just me.
Yeah.
This is, I always say, I'm the founder, but they're the keepers.
Of course.
Okay.
Yeah,
and
of course.
Without
you were the
keepers,
founder, so I want to make sure that you just I don't want to lose sight of the fact that you had the courage core value,
Yeah.
to pick up the phone to Lifeline and make that call. And I love the word courage because it's from the French word, isn't it? Cœur is heart in French, and courage means heartfelt. Courageous is heartfelt. And so there was something heartfelt and brave in picking up the phone, having that call.
Yeah.
And it's led to this.
Yeah.
And so now, how many people do you have running? So they're all trained, properly trained, kind of support advisory services.
We've got over 80 crisis supporters.
Wow.
And growing. We want to hit over 120 crisis supporters in those 3 centres, and we're constantly looking for more partners around throughout the country, because end of the day it's run by volunteers.
Yes.
And volunteers travel from all sides of the country, so we're looking for other centres as well. So 1333, which is CCC Line, is doing amazing work. The crisis supporters are so passionate, and they use the values of courage, compassion, and commitment. And if you look at the phone number, 1333,
CCC.
absolutely, 333 is CCC.
Yeah.
And it takes courage, compassion, and commitment to save one life. And that's our motto, to have 3 C's to save one life. And it starts with one life. And today, I'm very proud to say that when we first started CCC Line 1333 in December 2009, the suicide rate in Sri Lanka was around about between 15 and 18 people a day. Today, it's 9 to 10 people a day. So it has a significant effect on preventing suicide. And I've got to say, hand in heart, we've had a significant amount of impact on that. And all the other service providers.
Of course. It's a network. It takes a village. All that kind of good stuff, right?
Yeah.
But it's incredibly powerful. You must be incredibly proud of that, and of the team that you have.
Proud of the
place.
team
Yeah.
that is day in, day out, who is showing courage, compassion, and commitment, instilling courage, compassion, and commitment to our callers.
They're showing courage. The people that are calling are showing
Absolutely.
courage, right? And compassion towards themselves, as you said before. Right?
Yeah. And that model, our values, and that's probably why we've been here for that long, run by volunteers. I'm still a volunteer for the project in Sri Lanka.
Yeah.
For 22 years, I've been a volunteer.
Yeah.
So is my committee here. So is my committee in Sri Lanka. They're all volunteers.
And you don't just volunteer on the line. You also organise I quite like this. So the number is 1333, and then every year you organise a fundraising bike ride. Well, not just fundraising, but also an awareness drive.
Awareness, yeah.
And you do a 1,333 kilometre bike ride around Sri Lanka
in 13 days.
In 13 days.
So
there
roughly
you
about
go.
100 Ks a day.
There you go.
And I remember my wife and I were sitting down and thinking, how can we? What kind of event can we do to raise awareness? And can we do a walk, whatever? And then it starts with 133 kilometer ride, and I'm not a bike rider. and all of a sudden, and I kid you not, I went to Google, Sri Lanka map, 13, a few places around there, and I looked up, and it says 1333 kilometers right around Sri Lanka.
Yeah.
And that was the
Ding.
deciding moment.
Yeah, of course.
So today, we just completed our 12th year of the bicycle tour. Nice. It's amazing.
Yeah.
Yeah.
So it's a huge fundraiser. Again, I understand you raise awareness as well. So you distribute leaflets, you let people know in all the villages you pass through.
There's a peak of phone calls on that month of September. And we start 13 days before World Suicide Prevention Day.
Yes.
In fact, this year we're thinking of maybe starting on World Suicide Prevention Day as well for 13 days, 1,333 kilometers.
It brings focus and energy to it, I understand
absolutely.
that. Yeah. And then there's that challenge of sustaining it through the year, of course,
Yeah.
but it does give you that focus.
Yeah.
Buns of steel to do 100k a day for 13 days. That's pretty. That's hard.
Literally.
I'm okay running, but riding that wolf, that's something. But I wanted to maybe, you talked about the rates of suicide, and we'll jump to it now. I think it's an important topic. There is a high percentage of those deaths by suicide are men, and I look at the stats in Australia and other parts of the world. And a high percentage of the men are in midlife. It's and there's a whole bunch of things we could unpack around that. But I'm assuming that the same statistics occur in Sri Lanka, that it's predominantly men that are choosing to die by suicide for whatever reason.
On average, there are more men dying by suicide than females. But any suicide is is too many.
Of course, one's too many.
Like I can talk about the statistics in Australia. There are 9 people who die by suicide every day in Australia. There's 9 people today, and there'll be 9 people tomorrow. And out of 9 people, 7 are men. Wow. And that's roughly the world average.
Why is that? Have you done any research? Have you looked into that? Is there any views?
I think it starts when we are boys. Things like, toughen up, being not able to show our emotion as we grow up as men. Don't cry like your sister. Stoicism, all that. There's expectation that men should be stoic. Men should keep things inside and not show any weakness, not show any vulnerability. And I know there's so much messages out there saying, please talk about your stuff before it's too late. But it's unfair to ask a man to talk about their stuff when, as a boy, they've been asked to just toughen up, man up.
Yeah.
But even when man is down, we ask them to man up.
Yeah.
Right? So I think it needs a total new look at the way we encourage men, specifically, in this case, according to your question, how we can bring up our boys to be more open and willing to be more vulnerable and authentic. Yes. I look at vulnerability as being authentic.
Yes, it's a strength. It's a strength.
It's a strength.
And that's a beautiful segue into the work that's you've started to focus on more recently, which is Let's Talk. And as said during the introduction, right, about helping create that psychological safety so that people can be seen and heard and valued. And it's psychological safety, to my mind, is about creating a space for people to be able to be vulnerable and to feel safe to be vulnerable and to explore how they're feeling and to talk more openly. Was that the pathway that you took when you started going from CCC? You realised that there was something more you had to do in that space?
Yeah. Well, Let's Talk is part of CCC Foundation.
Yes.
So Let's Talk is still part of the charity. So
yes.
We are a tax-deductible charity. And actually, Let's Talk started from an idea from 1333, CCC Line. I get a report from the Lifeline Centre, CCC Line in Sri Lanka every month.
Okay.
And I'm an engineer, I'm a numbers man.
Yep.
And there are 21 reason codes why people call. And if I did the bell curve, right in the center mean was relationship issues. Right next to it was loneliness. Next to it was economic problems. And I'm going, hold on, people are calling, the majority of the calls that we get are for relationship issues, loneliness, economic problems. Then came the heavy duty abuse, mental illness, disability, and suicide ideation. So for me, being a simple-minded engineer, I'm thinking, why are people picking up a phone and calling a total stranger? And that's exactly what any of these phone lines are. A crisis support is calling a total stranger to talk about relationship issues, loneliness, and money problems. Why can't they talk to mom and dad, husband, wife, brother, sister, friend? Okay, so the answer is quite obvious. It's the stigma attached to not just mental illness, it's attached to social pressures, social concerns in certain cultures as well, worse than others. So hence the birth of Let's Talk. There's no the word mental health in there, just Let's Talk.
I think, that's a really good point, and because I've seen some other programs where they talk about mental first aid, and I don't think those terms are helpful. I like the fact that it's Let's Talk. It's very positive. Yeah. It's very forward looking, and it's an invitation. Yeah. And I like that.
And it's fundamental because Let's Talk is about building that psychological safety, and the word psychological safety has sort of come up. It's been there for a while, but it's come up especially after COVID. And the best way to look at psychological safety and how it then affects productivity and innovation is this. And this could happen in a school or a workplace or a university. Just imagine, Stephen, if you're the teacher, if I'm the student and say, hey, Stephen, put my hand up, right hand up and say, I've got a great idea. Do you want to hear it? Now, I could do that because I know you're not going to judge me, you're not going to punish me, you're not going to, belittle me or ignore me. If I come to you the next day and say, hey, Stephen, I stuffed up. I made a mistake. You know, I'll do that because I can trust that you're not going to humiliate me, judge me, punish me. Now, if I was a school student or the teacher, what am I doing here? I'm surrendering. This is where you surrender your best self. At school, at home, out in the university, and the workplace. If our people in whichever organization can surrender their best selves with their ideas and mistakes and be open and transparent, that's when you have productivity. That's when you have innovation. That's when mistakes are okay. Because if you don't make the miss, you will never know your take.
Yes.
Okay? Yeah. That's my definition of mistakes.
Yes.
You know,
yeah, of course.
If you're not willing to take your miss, MIS, you will never realize your take, the best of who you can be.
So what you've done there is you've kind of taken this wonderful idea about vulnerability and encouraging people to kind of open up and connect and communicate. Super important part of mental well-being in a family and community context. Yeah. But you've also then been able to say this is incredibly relevant in a corporate work environment context as well, because of some of the corporate cultures that exist. Yeah. And where those corporate cultures exist that don't allow for that contributes to that isolation, that contributes to that loneliness, that contributes to that bottling up, that leads on to all the other issues. So it really is a preventative program that you're talking about. It's not intervening after someone's experienced something. It's actually creating an environment so that you never find yourself going there in the first place. Is that right?
Absolutely. And I always, coming from a corporate background, I look at an organization before I started and go, okay, what are we trying to achieve here? And the vision and the word "let's talk," Stephen, is two acronyms. Let's stands for letting everyone talk safely. Okay, and that is the vision of the organization, letting everyone talk safely. So one day we are here and everyone's talking safely. Whoa, we've hit the vision. But why do we want to start in the first place? Seen, heard, and valued is the purpose, because everyone wants to be seen, heard, and valued as a human being. It's a fundamental need to be seen, heard, and valued. Yes, sometimes we don't want to be seen because of the stigma or the embarrassment, the humiliation, or the shame. But really, we want to be seen, okay? So in between our purpose and vision lies our strategy. And the strategy or the framework of the Let's Talk program is talk. Tell, acknowledge, listen, keep in touch. Seeing the telltale signs, or notice the telltale signs within us, acknowledging with empathy and gratitude, thank you for talking to me, this must be really hard for you. Listening without judgment, and we go through a process of listening through neuroscience that we have developed ourselves, through our facts, feelings, and fears. Okay, what happened? How does that make you feel? What scares you most about that? So that even the youngest kids could understand this framework. And care for keep in touch is, how can I help you? Or, Stephen, shall we go out and get some help for you? I'll come with you. Okay, that's the talk framework.
And you teach that in so I've been through the program, and you've delivered it in a couple of different formats. In Sri Lanka, we did it over 2 days, didn't we? Yes. I remember we did that together. We facilitated that. It was awesome. And then in another context with a regional team that I had the privilege of leading at the time, we did it remotely. Was it 8 single hour, 90-minute sessions that we ran over an extended period of time? Do you still runs in those two kind of modes?
We have actually, with time constraints, we've actually made it 1 day, face-to-face, or 4 sessions online. Okay. So we run it at schools, and for me personally, the focus of late has been primary schools and some secondary schools as well, because as I said earlier, in the context of men and suicide, we need to start with our boys.
It's preventative.
We need to start.
Stage.
We need to start with our girls. And Let's Talk is a preventative and early intervention strategy. It's about forming the neural networks as a human being to understand that opening up to share my ideas and mistakes is okay. Yeah. It's pointless for me to say to you, it'll be okay. Yeah. It's fine. Just mention. Just share it. Yeah. No.
If I'm not equipped with the skills to be able to do that, then I'm never going to do it, right?
It's not just with the skills, but the mindset.
Yeah.
Because the mind because the mind and the programming, it says, yeah, but I'll get in trouble. Yeah. There's a consequence for this.
I've got to tell you, the amount of times that I've used the facts, feelings, fears idea, it is so prevalent in everyday conversations in a corporate context. I hear people so regularly, they start the conversation with fears, and I remember that, right? Most people, the emotional thing happens first. You kind of go, I'm scared about this. I'm really worried that I'm going to get, the boss is going to be angry at me. I'm really worried that I'm going to be fired tomorrow, whatever. Okay, well, so what are the feelings that sit behind that? So they'll express a fear, then they'll talk about the feelings. I'm really agitated, I'm really scared, I'm really nervous, and then they'll eventually come to the facts.
Facts, absolutely.
And it's a not constant, but I in those moments I say, hey, let's flip it around.
Yeah.
Let's start with the facts. Let's be really clear about what's going on first.
Yeah.
And then the journey through feelings and fears, I don't know, somehow it seems to become easier to talk about it.
Yeah.
You seem to provide a better context for those feelings and those fears. Because if you don't do it that way around, all those fears and feelings tend to overwhelm and dominate the conversation, and the facts seem to go out the window.
Yeah. So the model is we meet in fears or feelings, and we propagate to facts. Then we come back to fears and feelings and fears. So for the audience who is probably wondering, what is this facts, feelings and fears? So very, very simply, neuroscience is that we have a prefrontal cortex that we call facts. This is our executive functions. Right behind it is our old brain, our limbic systems that handle our feelings, and right underneath that is a little almond-shaped gadget. We call it the amygdala. That is your sentinel, the fear center. When somebody's upset, naturally they're not going to be in the facts quadrant. They're going to be in if there's 3 rooms, they're going to be in the feelings room or the fear room.
Right back here.
So you need to meet them there.
Yep.
Saying things like, "You're right," is a very digital no, yes or no answer. You know what I mean? So you need to meet there and say, I see that you're feeling sad. I hear that you're upset. I feel that this is worrying you. I know that things have been hard. Use the gadgets that you've already been given, your senses, to ask. Meet them there, and then take them to the front room to look at the bigger picture. What happened?
Look at things a bit logically and structurally and begin to work it out.
Absolutely.
Yeah.
What happened? And then you dive back into feelings and fears. How does that make you feel? What worries or scares you most about that? Back to fears. And it's when you tick the fears box that you really get to the root cause of what the concern is.
Yeah.
So this framework works really well with kids and with adults because it's simple, and people remember the TALK framework.
Of course, it's a good acronym. Now you said something really important there. You said it works really well, right? And so let's unpick the evidence. Sure. So I know you've done a lot of research around this. In fact, over the last couple of years, you've been working super hard to get proper evidence, documented research to back that up. So tell me a little bit about that.
Well, I mean, working in schools, it's got to be an evidence-based program.
Yeah.
So last year, we worked with a university in Melbourne called Swinburne in Australia. And also we collaborated with the Black Dog Institute, the University of New South Wales, a couple of other universities. They looked at 10 schools in Melbourne and ran a full randomized control trial, which is the prima donna of research. So 5 schools did the intervention and 5 schools did the control.
So you did randomized control trial. You actually did A/B, right?
Yes. Okay. Yeah, randomized control trial.
Gold standard.
Gold standard. 10 schools. Pick the 5 of intervention and control. 12 months later, after many surveys, right through from start of the year, term 1, term 2, term 3, term 4, huge amount of data, close to 500 kids, students involved, and teachers as well. There was significant improvement in psychological safety, significant improvement in help seeking, support from teachers, and well-being. So today, it is an evidence-based program.
Okay, and so it's quite interesting. We talk about RCTs because in a couple of previous interviews I've had, we've explored all the effort that's involved, the moral hazard, but what emerges is there is a time and a place for it. And it strikes me that this is a great example, that you've now got evidence-based program that hopefully will now enable you to attract funding and interest, and schools will be, we're prepared to invest in that because you've got the research to back it up.
Absolutely.
Right, so that's a super important part of your growth strategy.
Yeah, and I think we touched earlier about the purpose, and I think for me what really resonates about the program is its purpose of seen, heard and valued. And we don't necessarily talk about mental health because especially for children and young people, what is really important, rather than understanding what anxiety and depression is, which is important, by the way, I'm not going to say anything negative about that. I think that's really important. But what's really important is the ability to be seen, heard and valued.
Yes.
To be included, to be understood, and most importantly, to be valued for who they are, to build their self-worth, and especially in today's environment, uncertainty with AI and with social media, the ability for young people to build their self-worth is paramount.
But you've made a point, and I agree with you about the young people, and I think you start there, like the early intervention is crucial. But you made a really interesting point that this is as relevant for adults as it is for kids, and I'm assuming that actually, in terms of cultural context, this is relevant for Australians as it is for Sri Lankans, as it is for Brits, as it is for... So it's actually quite universal, right? It's got a universal applicability, and you found that you've delivered these programs in different cultural contexts, and it works, right?
Yeah. And last year, I got a email from San Francisco, of all places.
Oh, really?
Yeah. It was a university in San Francisco who was interested. And I said, look, we're based in Melbourne, we can do some online training. They said, no, we want you to fly up there. So actually last year we went and we did a university, San Francisco Bay, and we trained teachers and students to be Let's Talk mentors
for you,
and also we ran our suicide intervention training as well. So it's small steps. Our focus obviously is with the young people, with the youth, because end of the day, that's when we start our journey to be open, to be authentic, to be vulnerable.
Yes. Yeah. Wow. Let's unpack vulnerability a little bit. Let's use that as a segue into your personal story.
Sure.
Once again. Now, my understanding is, you've for a large part of the time that you were focusing on CCC Foundation and building out Let's Talk, you were juggling that with a corporate life.
Yes.
You talk about being an engineer, and you've had professional work as well, and kind of that balance, right? So however many hours you must have been pumping out during that time. Recently, you've made that decision. You've decided to step full time into Let's Talk and the work that you're doing with the Border Foundation. That is a leap of faith. That is a quite momentous decision. I imagine there might be others that are sitting with a similar decision that they're facing at the moment, that might be listening to us now. Talk us through that journey. That's what sparked it. What was the impetus, and how does it feel now, having taken that step?
It's been a juggle while working, and my corporate career, from engineer to production manager, and then I had a sea change in the middle.
Yes.
In disability for 7 years.
Yes.
As a CEO for organization, and then back into corporate, and it came to a point where, and mainly because I was focusing on schools here in Australia, and I was juggling between taking days off, half day here, a few hours there. It just wasn't working.
Yeah.
And sat down with the wife, did the Excel spreadsheet.
That's a hard conversation.
What a typical engineer. Can we afford this? And my wife was extremely supportive, and she understands my passion for this kind of work. I had an investment which I, sold and, reduced some debt, so that it wasn't just jumping blindly, it's jumping with a planned strategy. But it's been really tough, to be honest with you, because I've jumped into the deep end. I'm not a teacher, I don't have a school's background, and all of a sudden in the last 4 years I've learned about teachers. I've learned about principals. I learned about schools. Learned about kids, their needs. And it's not just having a program. It's about how does that fit into a school environment. And it's been very challenging. But the outcomes, just the feedback I get from the kids, the teachers, and the principals has been amazing. And that's the power that just keeps me going forward. But it has been a tough time, because there's been so much certainty in terms of income, for example, or just hours of work. Everything's changed now. There's only a trickle feed of income, into a new environment. So it's been a tough journey, but it's been a meaningful journey.
Yeah.
Yeah.
I mean, that's something I really want to draw out as well. So it sounds like you are coping. You've got the support of a family, structure that's enabling you to take that, which is great.
Well, I'm using Let's Talk on myself.
Right. Yeah.
Seeing my telltale signs, acknowledging that this is difficult, listening to my body and resting when I have to, and then keeping in touch to say I need help.
Yeah. Yeah. Of course.
So if I'm, can you imagine? Here's this dude who's trying to, get this program up and running, breaks down.
It's not going to work
in stress, and it's not going to work.
But you've very consciously, in that leap of faith, is taking yourself outside of your comfort zone, which is the kind of, although it would have been hard balancing the two things, there was at least the comfort of income and all those types of things. And I found myself using this phrase before also, which is when you're outside your comfort zone, the tendency is to want to rush back towards your comfort zone. Yeah. And I think it was a lady, I can't remember, there was a presentation I saw, a lady, she rode solo across the Atlantic, and she used this phrase about, do not go back to your comfort zone. You wait for your comfort zone to come to you. And there's something about that of learning to live with the discomfort, and finding meaning and joy in it, and purpose, and balance in some way, right? And eventually that becomes your new space.
Well, the Buddha said, Madhyama Pratipatava, which means the middle path, and that is the balance between pain and pleasure. What's that word? Homeostasis, right? Homeostasis is the balance of pain and pleasure. And constantly, as humans, we the default is pain. Hence, maybe why he said life is suffering. And these days, we try to pump up the pleasure to compensate with, all sorts of things. It could be scrolling in on your mobile phone. It could be alcohol. It could be, porn. It could be anything. Excessively to balance that, and we're finding it, the body can compensate and it makes things worse. But as you said rightly, it's about the best way is to sit with the discomfort until the pain comes back to the middle path, and that is the more sustainable way forward.
Yes.
I'm learning that. Nowhere have I mastered that. Is to sit with that discomfort, sit with the suffering, and understand that this is actually normal.
Yeah. This
is the human condition.
But it requires a certain intentionality, right? I totally buy it. The wisdom comes through some measure of suffering, right? And I don't think that's too much of a leap of faith to say that. I think that's...
It's the best teacher. Yeah. Just embrace suffering, because without it, some of us, including myself, will be falling asleep. Yeah, no, and I always look back and say, thank you so much for my OCD. Thank you so much for my mental illness. Yes. Because it woke me up to do the work I'm doing. There's no chance I'll be doing what I'm doing if not for my mental illness.
Yeah, of course.
Or in this way, in the mental health area.
Such intentionality around that. The courage to kind of go, I'm going to hold that space. The commitment to stick with it as well, which you're showing at the moment. It's like you believe in it. It's bringing purpose. I feel the purpose, even in the conversation. I'm sure that folks listening and watching this will feel it, even as they're listening to us talk.
And I was saying earlier, if you want to find purpose, you're gonna understand your pain first. Yeah. And take one little step to make a difference. Yeah. One little step to make a difference, and all of a sudden, rather than finding your purpose will come to you.
It'll find you.
And then in that intersection of pain and purpose is your power, and that's the power I feel now, to go through my suffering or my uncertainty to do what I'm doing.
Is there also joy in that moment?
Well, power. Yeah. It's joy. It's feeling that their self-worth.
Yeah.
That's the ultimate.
That is incredibly
feeling.
powerful. That meaning that you must derive from that is incredible.
Yeah.
And I see it also. I have to say, I've visited the helpline, the first helpline in Colombo, and I've met some of your volunteers, and I see that sense of purpose and meaning in the work that they do, and how proud they are to be part of that.
They're incredible.
Right? It really is quite something. So okay. Where to then? You've taken a leap of faith. You've built this out. You've got your evidence-based research. You're rolling it out in schools in Victoria. What's next for Jetha and the Let's Talk program?
Well, the journey has just begun. Mm-hmm. Okay, and for me, my passion is primary schools and high schools because the journey has to start from where our children to our youth. So our strategy is over the next 5 years is to build the number of schools here in Victoria, in Australia and nationally. Obviously, we are doing the program in Sri Lanka as well because I've got a team there. And anyone watching who wants to implement the Let's Talk program in their country, in their state, please, we would love to
reach out,
reach out and help you to do that. And I think there's a requirement for the program in the universities as well and workplaces. So I think workplaces, we constantly look for productivity and innovation, but productivity and innovation does not happen with that word psychological safety. The ability to come to your leader and say, look, I've got great ideas, or look, I've made a mistake. That's the impetus to innovation and productivity.
I just want to kind of validate that a little bit. So obviously we rolled the program out. I served as regional president for APJ Mir at a company called IFS, Enterprise Software Company, for a number of years, and we rolled out the program. I think it was a few times, right, over a few years. We kind of rolled out with different groups. And look, I won't say causation, I'll say correlation, but there was a very clear correlation between the folks that went through that program and higher employee engagement scores. We ran regular employee engagement surveys. We could validate that because let's look at the scores of those that participated and those that didn't. There was a difference. Well, not huge, but there was a difference. Employee engagement drives productivity. What we also noticed was a correlation with lower voluntary attrition. So higher engagement, lower attrition, like people choosing to resign. And again, I'll say correlation, not causation, but that is meaningful for corporates, right? Putting it in terms that I think organisations understand. Who would not want a more engaged workforce? Because it does drive productivity. Who would not want psychological safety in the workforce if it drives lower attrition and a sense of better teamwork, right? So there's very clear benefits to running these programs, setting aside all the other things of the kind of preventative and early intervention, and all the stories that I've heard afterwards of people saying, we've run this, people would come back to it in later after the program and say, I know we did this for the organisation, but geez, I tried it out on the missus when I got home, or geez, I've started talking with my kids a bit differently, and kind of works in that context too. Go figure. So the ripple effect beyond the workplace, I think, is also something that we should acknowledge.
Look, it's a program for anywhere and everywhere, because letting everyone talk safely. It's not just at workplace, is it? It's at home as well. And it's got to start from home, into schools and to workplaces.
So that sounds like, this sounds like a really a good enough place to kind of to say that. So in terms of how do people can get involved in that, absolutely there's workplace programs. So if someone's responsible or they're interested in that, to reach out, corporate context. You're rolling it out into schools, so maybe if there's folks listening from the education, world, then also they can reach out, and you've got package programs you can roll out for schools. It's evidence-based, super important. And I guess otherwise, people can find you. Right, the Let's Talk programs there, and on the web, or we'll put a link with the podcast there. And, I'd sure like to see people lending their support from that, even with donations, right? Because it helps you do more of the good stuff that you're doing. So you're going to continue to roll the programs out. Now you've stepped into it. Any other programs? Any new ideas on the horizon, or is it really just about scaling this thing now?
Look, we're definitely about scaling as well, but also we're developing an app as we speak.
Okay, cool.
For schools. And then we want to roll that out to the public as well. It's the ability to not just reach out to someone and support someone, but also to reach out to ourselves. and investigate our own telltale signs. How often do we do that? It's always about helping somebody else, but how about helping ourselves? Because this is where it starts. It's about seeing our own telltale signs. It's about acknowledging our own concerns and worries and fears. It's about listening, not just to what we are thinking, but also what our bodies are telling us, but also keeping in touch with family, friends, and asking for help. And for the first time, I'm really interested and excited about this. One of the schools who started with us in 2019, next year is going to do a play on Let's Talk. We call it Let's Talk It Out.
Oh, really?
It's going to be amazing. It's going to be on the 3 Fs as well, facts, feelings, and fears. Yeah. So it's a bit of a neuroscience look at conversations and concerns. The ultimate aim is to break the stigma, because the words you don't tell me, I can see in your brain, what the brain's thinking, and I'm really looking forward to that. So a few little things happening. Yeah,
there's lots going on. But look, there's so many reasons for me to feel gratitude towards you, Jetha, for your friendship.
Thank you.
For being the spark for the work that I've done with the IFS Foundation in Sri Lanka, for teaching me so much about that beautiful country and enabling me to contribute more meaningfully, having understood it a little more deeply. So and the opportunities to contribute to the things that we've done together around CCC and Let's Talk. But also thank you for your time and being so open in this conversation. I think you've demonstrated those attributes today.
Look, I've got a quote, 2 words my dad told me once in my early 20s. And I can't exactly remember what I was explaining to him, but I was rushing through something. I was like, I've got to do this, I've got to do that, I've got to do that. And he said in Sinhalese, which is a language we speak in Sri Lanka, hemming. You probably heard of it. Means slowly. And those words at the time probably annoyed me because I was in a rush. But 30 years looking back, I'm looking back and going, oh my gosh, he was absolutely right. And through the struggles I'm going through my uncertainty, and because I'm pushing myself, I hold to those 2 words my dad told me, hemming, slowly. And it's almost taking a infinite mindset as opposed to oh my gosh, I need to get this done tomorrow, a finite mindset. So I'm very thankful to him. I'm thankful to my mum, who actually gave us the opportunity to come here to Australia as well. She was I always say she's the one with the courage to come here by herself and set up everything for us. And Dad is the one who taught me compassion with his charity work in Sri Lanka. And commitment just came, because without commitment we don't have the discipline to go forward.
Yeah, and there's something beautiful in what you said, that thing about paying it forward, right? Your parents have shown those things, and we there's an invitation there for each of us to step into the values that we hold most, not only for ourselves, but also in the way that we pay it forward. What do we teach our kids? What do we teach our friends and our peers? And clearly you've soaked up those lessons, and now you're living and breathing those things every day, and it's just wonderful to be a part of it and to witness and observe it and to support in some small way. What you're doing is fantastic, Jetha.
Thank you for the opportunity,
and thank you for being here.
And thank you for your help.
No, come on. It is genuinely, from my side, it's actually a privilege, because it means that we can be a part of it and see what's happening, and I learn a great deal from you. So thank you, and thank you also for your time today and making the effort to come up to Sydney.
Thanks,
and very good. Thank you.